Whether you're considering the procedure yourself or not, Jacky Oh died from complications of her BBL.
The clinical name is fat transfer. It could be breast augmentation, right, increasing the size of the breast, or breast reduction. They're not doing it to look cute.
Right.
They're doing it to feel well about themselves.
Please welcome to the cafe, y'all, Dr. Angelina Postoev.
I think it's part of obesity bias.
Sure.
Cheaper is not always better.
Cheaper is not always better. Everybody's got a body, and I know bodies. Being in this body is something that we've got to do every single day, so we may as well master it. I'm your host, the good Dr. Dave, and this is the Health Mastery Café, your #1 brew spot to do that, to master your health. And in today's episode, we're slicing into the world of transformational surgeries. We're sipping on this rich blend of bariatric surgery, gonna define it, and cosmetic procedures that are not just changing people's bodies, but also changing people's lives.
Hey, I am Rashawn Ali, multimedia personality, actor, and author, and you're watching the amazing Health Mastery Café with Dr. Dave.
Now, whether you're considering the procedure yourself or not, or you just want to know about it, know information, I'm telling you, this is the episode for you, because my guest is none other than Dr. Angelina Postoev. She's not only an entrepreneur, she's going to talk a little bit about that. She is triple board certified. I want you to know how difficult that is, and she's going to tell you the story a little bit here. I'm welcoming to our cafe Dr. Angelina Postoev. We call her Dr. Angelina.
Thank you for having me.
Thanks for being here. So the way we start with all of our guests is we ask them what's in their cup. What's your favorite brew? I'm a coffee guy, been bringing in some tea. What's in your cup, Dr. Angelina?
It's Saturday.
Is that, yeah. Oh, that is nice. Yeah, moonshine.
You want to smell it?
Yeah, no, I did. Moonshine. No.
It's from over there.
Yeah.
It's a little bit of Hennessy.
But why not? Why not? So on your average morning though, what would you say?
Coffee.
Coffee.
Definitely coffee.
Not tea. Tea's non-strong.
Tea's afternoon.
Tea's afternoon. Okay,
Yes.
so you do both. Okay. All right, good. We've been kind of talking off air about some of the statistics and the misconceptions that are out there. I really want us to go through all of it. Remember, we're going to talk about bariatric procedures. Some people just don't understand intuitively what that means. We're going to talk about it.
Yes.
But before we get to that, because I think that's where the biggest gap is, I want us to talk about some of the cosmetic procedures. One of the statistics that the producers found was that pre versus post-pandemic, there was a 20% increase in cosmetic aesthetic procedures, right? Cosmetic surgeries. Do you have a sense of why that is? What was it about after the pandemic that increased it so much?
I don't know if we know exactly why people do that. From my experience, that people feel like we live once. Life is short.
Yeah.
And if I was putting off self-care, I call it self-care, every time we do mommy makeover or anything for ourselves like that to make us feel better.
Yeah.
A lot of females will put it off. You know, right now I'm taking care of my kids. Right now I'm taking my parents.
That's
and
right.
then they keep pushing it down the line until they're 60 years old. Is it too late to do this now? Because I still want it.
Yeah.
You know, so I think now people just said, you know what, we're going to do it.
Is it too late at 60?
No.
It's not too late. Depends on what it is.
Depends what it is and what your health baseline is.
Yeah. One of the things that I think a lot of people are tuned into is DC Youngfly's wife, Jacky Oh. She was 33 years
young.
old, very young. They have 3 kids, and she died last May. And the autopsy said that she died from complications of her BBL.
Yes.
I want to just go zoom all the way out for everybody because we think we know what BBL stands for, but what is it actually? Give us the clinical name. What is a BBL?
So BBL stands for Brazilian butt lift. The clinical name is fat transfer. So it's a procedure where a doctor would take fat from one part of your body and transfer it to the butt area to make it bigger, make it plumper, shape better. So it's a shaping procedure.
1 in 4,000 BBLs dies. To me, that's too many. Does that seem like a high percentage?
1 is too many.
1 is too many.
One in a million is too many.
Yeah.
But yes, it's definitely much higher mortality than we expect from regular elective surgery.
Yeah, right. Regular elective surgery, and for the reason why people do this one, and there are many reasons, and we're not judging on the reason, but it just feels like an elective surgery like this. I don't know that people understand that that's the risk. 1 in 4,000. Why is BBL so risky?
I'm sure there's many factors, and we mentioned some of them before, that the length of procedure, the amount of work needs to be done. is greatly underestimated by patients. I believe a lot of patients don't take liposuction seriously, right? To do the BBL, you have to do liposuction.
Yeah.
You got to take the fat,
Yeah.
then transfer the fat.
Right.
So liposuction is much bigger deal than people think.
Sure.
You know, just because there's a lot of chop shops doing it everywhere, popping out in every corner, we can do it without anesthesia. We can do it, meaning, to me, translation, uncontrolled environment.
Right. Without anesthesia?
Right. There's a lot of the chop shops out. I call them chop shops.
Well, I mean, if they're doing it without anesthesia.
They're doing it without anesthesia. They do not look at patients' health. Very rarely they even care about what their BMI is. So they're picking patients that are not healthy to start with sometimes.
Yeah, if they don't look at the chart, they don't even know.
They, do things without anesthesia, without control of a second doctor. They're helping you out to monitor all the vitals.
Right.
In some of the places, we're not going to name any particular ones, but there are places out there that pretend to be, medical place, but then doctor does not do the procedure himself.
Yeah.
It could be an assistant doing a procedure.
Yeah.
So I'm not saying it happens everywhere. Obviously, those are specific places. And I'm not saying regular plastic cosmetic surgeons not going to have that complication. But I think that the risks are higher if you underestimate what you're doing and where you're doing it.
Well, let's back up, right? What are the risks of the procedure? That particular procedure itself, what are the risks? I think people should know that.
Right. Well, so number one risks will be general surgical risks, like anything else. Your anesthesia risk.
Yeah.
And you probably know more about it than I do.
Yeah.
Right?
Clearing
so
people.
you're clearing people for surgery, your cardiac risks.
Yeah.
So you have to get a healthy person to start with.
Right.
Then bleeding and infection, right? Doesn't matter how small the cut is, even for liposuction, tiny little cut. Every time somebody cuts on you, there's risk of bleeding, infection, sepsis.
Every time, no matter how small it is, there's a risk of bleeding and infection. In the office-based procedure, surgery center, or hospital, doesn't matter. Okay.
Procedure is a procedure. There's no such thing as too small a procedure.
Right. You can have any of those.
You can have a side effect.
Okay.
Next risk will be lidocaine toxicity.
Lidocaine. So we use that to numb different areas when you're going in with the tool.
If you're especially doing those awake liposuction I mentioned earlier.
Let's not do that.
Let's not do that.
Yeah.
The risk is they have to fill you with a solution called tumescent solution first. That's basically saline mixed with lidocaine, which is the numbing solution. So that way, if you're doing liposuction, the person is not running off.
So before there's any,
fat
suction,
sucking out, yes.
The anesthesiologist.
Well, doctor, the surgeon. The surgeon
you
does
actually
that.
do that.
Yes.
You're numbing all those areas.
We have to numb all those areas. And
Anesthesia's not doing that. He's just watching the heart and the lungs.
Correct.
Yeah.
Yeah. The performing surgeon's gonna do that.
To do it.
Tumescent solution injection first. That's first step.
Tumescent solution injection.
Correct.
Okay.
So we injected all of the areas we're planning to liposuction.
Yeah.
And then we go in with different instruments. Every doctor will have different set of instruments, and eventually we're sucking out that fat.
Yeah.
But that process of putting the fluid in, there's a risk that they may miscalculate your lidocaine, and it's weight-based, as you know.
Lidocaine is your dose is based on your weight.
Correct. So if you're trying to do too much at one time, and your doctor is not thinking about the numbers every single time.
You can inject lidocaine.
And it can be very dangerous.
Lidocaine is used in different places. We all kind of know lidocaine from dental procedures. Lidocaine can be used as a cardiac drug as well. So we've got some issues with that because you can stop the heart with too much lidocaine, especially if it gets systemic.
Correct. So then the next risk is if the person doesn't know what they're doing, as far as they don't have enough training, not enough experience, not careful enough, the long sticks that you see people doing liposuction with, those sticks can go the wrong place if person doesn't know what they're doing and perforate things inside your body. Give you pneumothorax, give you perforation of the bowel, give you perforation of the liver, and many other nasty things you do not want.
Yeah, so let's define that for people. So it's not a sharp stick, but it's, if you're using force, you have to use force to get in there. If you don't
have to use force if you do it right.
You do not have to use force.
I mean, mild, but you have to know what you're doing. So as a surgeon, I can go by feel. As a surgeon, I know what I'm doing because I've done a lot of laparoscopic surgery, right? I've done robotic surgery. I know what tissues feel like.
That's right.
For people who are not experienced with that, people who took that weekend course and decided to do that, right? Who are not surgeons, they can easily
because they don't
do damage without even realizing they did damage.
They don't have a feel. If that tool, what's the instrument called?
The liposuction probe.
Okay, the probe.
Let's call it that.
If that probe goes into the lung, it can deflate the lung. She mentioned pneumothorax. That's a risk of the procedure. If it goes into a liver, you can rupture, perforate.
Well, it's going to bleed a lot.
The liver, you're going to bleed a lot. It's a very vascular organ. Means a lot of blood vessels in the liver. If you do that to the bowel, now you got a whole other problem. You might be able to convert open and then fix it.
I can fix
right?
my problems.
But
if I had them, I don't have them.
Well, because you're triple boarded, right? But if it sounds like, yeah, just put a little hole in the bowel. But then you expose a whole bunch of bacteria to the inside of your body and you can be very sick very quickly.
Very quickly.
These are some of the risks. Now, some of those are rare, would you say?
They're pretty rare.
Perforation of a bowel.
But again, it's person dependent, meaning
the
it's technical.
Procedures, yeah.
So you have to know who's doing your surgery.
The operator, so this is the theme. If you're going to do this, you got to do research, right? Yes. What are the risks? What are not just the risks, but if you go to the internet right now, it's going to give you some average risk, maybe of the United States. Your question to that operator is, what is your risk? What are your numbers? How many bowels have you perforated? I know it's going to be, a lot here, but we're giving people information.
Yes.
Let's switch a little bit because I want to know what happened to Jacky Oh. Did she have one of those that we talked about, or is there something different?
No, so the risk is different. We continue talking about risks. We take the fat that we sterilized, sterile, you're supposed to keep it sterile when you harvest it, and then it was placed back in her buttocks, right? So the risk there, when you place fat back in the buttocks, if operator, again, the surgeon, goes a little too deep potentially into the tissue, so into the muscle, fat can enter not just muscle, but also large veins. And you don't really know you perforated a vein because veins bleed very slowly, and then fat gets in there and you get what's called fat embolism.
Yeah.
Fat embolism meaning fat travels through the veins into rest of your body and can cause all kind of major problems throughout your body. Yeah. And we know there's really not a medicine we can give you to reverse it, right? Like if you had too much lidocaine, we have certain things we can inject you to try to reverse it. If we injected a little too much fat in you, which you're not supposed to do at all, there's really not a reversal agent. Yeah. So then here, what happens here sounds like, and again, we're speculating, we don't have official data.
Yeah. For her case specifically,
she started having symptoms in the morning, the day after surgery.
What were her symptoms? Do we know?
Severe headache.
Headache is one.
And then eventually it progressed to change of mental status.
And then
so
she
started getting confused.
Yeah, confused, not thinking straight.
I do not know if there was any history of petechia, which are little red dots throughout a body. That's, issue with thrombosis. Yeah. So there are several symptoms of fat transfer embolism, and headache is one of the main ones.
Yeah, so that fat is really important. We kind of summarize. When she's moving the fat, she's really careful to place the fat on top of muscle, not within muscle, because hiding in muscle are veins, small, medium size, okay?
And big.
And large ones.
And very large ones.
And if fat gets into the vein, it's just going to join the circulation. What she pointed out was there's no way for your body to break down fat inside a blood vessel. If you get a tiny clot, we've all heard of a pulmonary embolus or a lung clot. Your body has natural ways, and sometimes it's not enough, but we have, as doctors, ways to bust a clot. We can't bust a fat clot embolus.
Nope.
And it's all because of a surgical the surgeon, the operator mistake, and we don't know for sure, but we think that this may have happened because
that's speculation again, but that's what I'm thinking.
Because the symptoms, cognitive changes, disorientation.
First started headache.
Headache.
And then that's where another thing comes in. When you find a doctor to operate on you, you have to be comfortable enough with that person that if complication happens, because it can happen to anybody, really, they will take care of you and send you to emergency room.
Right.
Send you where you need to go. Because there's nothing really I can do about fat embolus in my office.
Right.
So I'm not going to tell you to come to my office.
Right.
Or if you were there, I'm calling an ambulance.
Right, and get you there quickly.
And get you to emergency room, and get you to ICU, and get you where I can put you on oxygen, put you on ventilator, give supportive care, whatever we can do in the critical care setting to try to support you and hopefully get your body to kind of, filter through it and somehow get rid of it. But there's really not, again, no magic other than supportive care. Yeah. And in her case, unfortunately, what we read in the news articles, again, I don't have any official documents, is that she came in with a headache. She was told to stop taking Zofran and take ibuprofen, something like that. And she was sent back home to the recovery house where she continued to deteriorate. And by the time they called 911, it was already too late.
Yeah, she probably already expired. Yeah. And we're not saying this to be dramatic. We're saying this to give you some education. Think about all the nuggets you just got about the procedure. So whether or not you're thinking about the procedure or not, for yourself, that's not the point. There's a lot of nuggets about how do you choose somebody who's going to do any procedure for you in this conversation. And because this is happening more and more, this is a conversation I think people should have.
Yes.
I want to turn the conversation.
Can I interject those
Yeah, of
surgeries?
course.
Because I know BBL is such a popular surgery, right? There's a lot of young people getting it. What should their checklist be before they go in?
I mean, standard checklist, again, reputable facility, reputable surgeon, right? Check the board certification on the board. So in my case, it's the American Academy of Cosmetic Surgeons. There's also American, Plastic Surgery Academy. Then where are we operating? Are we operating out of surgical center or the hospital, right? My surgical center is a center of excellence center, fully accredited. I got full anesthesiology team, everybody, they deal with all kind of patients. Make sure place is safe, that we're not doing it in a little office space, no anesthesiologist present. Does the doctor have privileges in the nearby hospital?
Right.
So if something happens, can he go and see you in the hospital? Even though he might not be able to do anything for you in the hospital, surgical, like if they intubated patient, complication in ICU, can your doctor be able to come and actually see that patient in the hospital? So like for me, I haven't been in the hospital for years, thank God. I have privileges pretty much in every hospital in the area. So if I need to, I can walk in there anytime.
Yeah.
And another thing with that important point, if your doctor doesn't have malpractice insurance, hospital will not give him hospital privileges.
Right. There are many things that you have
So you have to find out if your doctor
That's right.
doesn't have hospital privileges, why?
Yeah.
Right? Most states will not certify your hospital, your operating room in the office as an office-based surgery center or freestanding surgery center. They will not certify it unless you show that doctors have hospital privileges.
That's right.
Hospital will not give you privileges unless you have malpractice insurance.
Right. And board certification.
And board certifications.
Right. Yeah.
So then if doctor says, I don't have privileges nearby, then why? What's the problem?
Yeah. Do some more asking, do some more digging.
Do some more digging.
Yeah.
And it might be nothing. It might be just his choice. Doesn't want to pay the money. Fine. But you have to do some more digging then.
Yeah. Yeah. No, really great points. So thank you, Nick, on that one. I do want to turn to bariatric surgery.
Yes.
Because
My favorite.
yeah, I mean, it obviously right now, it's sort of in the common, sort of news cycle. It's taken a back seat to the GLPs, right? The Ozempics and the Wegovy's of the world. But the proven benefits long-term, both cardiovascular and otherwise, like long-term survival for bariatric surgeries, including the one that's commonly done now, gastric sleeve and bypass. I want to start educating people on this. Tell us what bariatrics is, give us some information on what is a bariatric surgery?
So bariatric surgery is weight loss surgery. It does not equal liposuction or tummy tuck. They're not the same.
It's not the same, because that would be the other
Because
side.
a lot of
That's
people
good.
think tummy tuck and liposuction is weight loss surgery, and it's not.
Right.
So bariatric surgery is specifically surgery where we physically work with the actual stomach, like not abdomen, stomach, where the food goes, and your intestines to make the stomach smaller and maybe reroute some of your intestines to help us absorb less calories.
Yeah. And that is the bypass.
And
Roux-en-Y bypass.
yeah, but there's like 10 other procedures. There's
Yeah.
mini bypass, there's duodenal switch, and there's a conversions from one to the other.
What's your favorite one? What's the one that you do the most? You think it's the most
So in my
effective?
office, I think gastric sleeve will be the most common.
Okay, so tell us about sleeve, gastric
So
sleeve.
gastric sleeve is basically, if you can imagine how stomach looks like, which is like just basically, food comes in through your swallowing pipe and then kind of goes in this big thing that looks like a stomach. Google it. We remove about 80% of the stomach and we make it look like a banana. We make stomach look like a banana, right? So
Yeah.
we remove the big chunk
the
that
big
stores
chunk is
the
at the
food.
top, the fundus, yeah.
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 And body of the stomach, and we make the whole stomach look like a little banana. Okay. And the whole idea is gonna minimize how much you can eat. But the main way the bariatric surgery works is actually, do you know how?
No.
It's not
Do
malabsorption.
you guys know how? Okay.
They actually figured out that people who get bariatric surgery in the first couple of years after the surgery, their GLP-1 naturally goes up.
Ah, look at that.
This is how I discovered GLP-1 medication to start with.
Right, a long time ago.
So your natural GLP-1, which we all make, we all have our GLP-1 medication.
More of it.
We naturally make GLP-1. That's our
Yeah, of course.
hormone.
Yeah, sure.
So when you get the bariatric surgery, your natural GLP-1 goes up. And of course, and some people may stay around for 6 months, 12 months. Everybody's different.
Yeah,
Eventually will plateau out.
Yeah.
But that's where you get the biggest effect of weight loss, is where your natural GLP-1 stays high.
So you get the restriction just from the
Plus-
food and the stress, plus your own hormones are like, oh, I see what we're doing.
Exactly.
We're trying to, that is really good, because one of the reasons why obesity, especially people who've been obese for a really long time, they could be children and be obese, their GLPs, they don't make as much, and when they do, it's not as effective. So it's a GLP sensitivity issue. And obviously just giving them exogenous GLP, boom, then the body's like, oh yeah, we can do this. We know how to do this.
Yes.
That's really interesting. But I do want to highlight that the surgeries on top of the abdominal muscle don't count as bariatric surgery.
Correct.
You may lose weight on the scale, but tell us what the difference is in fat. What does a fat do in liposuction, tummy tucks, versus Roux-en-Y bypass or sleeve?
Okay. So bariatric surgery, you're going to lose weight everywhere, but we're really hoping you're going to lose all the visceral fat, right?
Yes.
The dangerous kind of fat that sits inside your stomach, around your intestines, around your liver, and liver itself, right? We get fatty liver with obesity.
Yeah.
So when we start losing weight properly, we're treating actual underlying physiologic problem, metabolic disorder,
Right.
that is obesity, and then we lose weight properly and be able to maintain it. When you do liposuction or tummy tuck, we're just taking out the fluff on top.
Right.
It does nothing to your physiology. Excuse me.
Yeah.
Let me have
That's a
my...
good idea, actually. Cheers.
Exactly. Cheers. We don't change anything in your physiology, your food meal absorption, or how you process your food
Right.
during tummy tuck or liposuction. We're just sucking out the fat.
Yeah.
The reason I hate doing or even offering this procedure to somebody who's obese, they're gonna maybe think they look cute for a couple of minutes after that surgery, after tummy tuck, but then their body gonna try to gain that weight back.
That's right. The
Our
set point's still the
our
same.
set point is still the same.
Yeah.
You're gonna regain that weight back.
Yeah.
The fat may go to another location, usually switching to your visceral fat.
Does it really?
A lot of times when they overdo it outside and fat has nowhere else to go, guess what? They start
It
looking.
comes back into
They start looking thicker. So maybe here the skin is not hanging anymore, but you start to really look much wider from the side. So
Okay.
your actual waist circumference starts to go up.
So there is this is a bad metaphor, but there's a muscle memory. The fat remembers that it's supposed to be there because everything else in the physiology is the same.
Everything is the same. You haven't changed how you ate. You haven't changed how you process your food. So whatever got you to the bigger place in the first place, the metabolic disorder is still there.
You are saying underneath there, don't do this with one approach.
Correct.
You have a comprehensive approach to these. What's your setup? Do you have nutritionists and psych people that
We
that
have,
you refer
we
to?
have a full team of people for
Yeah.
everything. So if somebody comes to me, which happens every day, let's say a lady comes to my office, BMI 45, wants to get a tummy tuck. And I'll ask her, why now? And she said, I've tried everything, nothing else
You
works.
say, why now?
I said, why now? You're 45 years old, your BMI is 45, why would you
Right.
eat now? Like, what triggered you to come to
Right.
my office today? And the most common answer I hear, I've tried everything, nothing else works. I was like, so you had gastric sleeve or gastric bypass already? And she says, what's that?
Right.
They never heard of that.
That's right.
I'm
We
like, I don't know how you still can live in the United States and never hear of bariatric surgery.
That's why
it's
we're
literally
doing
like
this episode. Yeah.
everywhere, right? All the shows, they never heard of bariatric surgery. And they're like, well, I thought tummy tuck will be my bariatric surgery. I'm like, no, it's not.
Right.
Okay,
Yeah.
have you tried GLP-1 medications?
Right.
What's that?
Right.
Right? So then we'll have to back up. I'm like, all right, let's start from the beginning. Let's go to my husband's office, which is downstairs, and we'll have him evaluate you, and let's do gastric sleeve first.
Yeah.
Let's get you to the happy place, right? With surgery, medicine, whatever. And then we're going to take care of mommy and do the mommy makeover or whatever it is.
Right. And that's that full 360 evaluation. There's a lot of maligning and ridicule and all that stuff of people who might do the different cosmetic surgeries. You think that there is a place for them in every situation for the right person at the right time. That's why you ask, why are you doing it now?
Why now?
Right? and really exploring that. And they probably never had to answer that question before. Having a somebody who is certified and has experience with the cosmetic reconstruction and transformation after the massive weight loss of gastric bypass or gastric sleeve is full circle to me, because you don't leave people feeling like I did all of this and I actually hate the way I look.
It
I
happens
might
very,
be
very
healthier,
often.
my A1C is lower, my blood pressure, I'm off blood pressure medicine, but I don't want to go out.
I'm not going out. Yes, and I don't find it cosmetic. I know we call it cosmetic surgery.
Yeah.
I do not.
After the
The after
bypass,
effect, yeah, I don't feel like it's cosmetic surgery, because when you have diastasis, muscle separation, when you have skin hanging and giving you all kind of problems, when you're not feeling well about yourself up here, we're not doing it for cosmetic purposes.
Right. Yeah.
People who lost 100, 200, I have people who lost huge amounts of weight with medications or surgery.
Yeah.
They're not doing it to look cute.
Right.
They're doing it to feel well about themselves, to be
Yes.
able to continue to enjoy their life.
Right. And to have more of it, right?
And more
Because
of
your
it,
survival
because
goes
now,
down.
yes, because now why did I do all this hard work, having the surgery, taking the medications, working out, doing what they're supposed to do.
Yeah.
And then they look in the mirror and they're like, I kind of looked cuter when I had all this fat hanging in the belly rather than this little empty sac that's hanging here now,
Yeah. Yeah.
right?
Yeah.
So then I really don't look at it as cosmetic surgery. I feel like it's continuation of medical care for the patient who already did so much for themselves to try to get the metabolic disorder under control.
Yeah. Yeah. And, well, if you think about the other side, there are people who purely want it for aesthetics.
That's fine.
There's nothing wrong with that
Absolutely
either.
nothing wrong with
Talk
that.
about some of the benefits of cosmetic surgery. I know we're circling back to it, but I want, because we didn't hit it. Tell us why that's good for people. What does it do
I mean,
for a
you
person?
look like this at 45.
Well, that goes without saying. Here you go. You heard it here first. And you are not 45. All right.
I'm 25
I'm checking the records
today.
here. Show me the license.
But yeah, it's just, you want to feel well about yourself. You want to, obviously a lot of women will come because they don't like the way the clothes fits or they cannot find it. And again, cosmetic surgery not related to weight. It could be breast augmentation, right? Increasing the size of the breast, or breast reduction. Probably one of the best, most satisfied patient crowd that I get is breast reduction.
Yeah.
Literally taking weight off the shoulder. Again, it's not really cosmetic. It's
Yeah.
help, it helps them.
Yeah, of
Neck
course.
pains, headache, back pain, all of that stuff.
Long-term chronic back pain. Absolutely.
Long-term effects.
Yep.
Tummy tuck for a female who had babies. Again, I don't find it truly cosmetic. We're repairing things that were broken.
Right, sure.
But even if you wanted to do little things, and little fillers and little wrinkle, look, if it bothers you, you want to fix it and you can. Who am I to judge?
Right. Why
Right?
not? Right, yeah, yeah. Well, but that's the thing. Who are people to judge?
Right.
Because, what they don't see is a person, you don't know what somebody's gone through. You don't know what their childhood was like. It could be a perfectly beautiful person sitting in front of you, but you don't know if somebody told them that they were this, that, or the other all their lives. And now they do something that gives them full confidence. They can go be who they truly want to
Who they
be,
wanna be.
go accomplish the things they want to accomplish. I really understand that. But now we're couching it in the conversation of, if you're going to do that for those reasons, great. Know who's doing the procedure, know about the procedure.
Cheaper is not always better.
Cheaper is not always better, because when you go to some of these places, they don't have to see you again.
Exactly. And I see so many people coming from out of town places.
Yeah, like out
Or
of the
even
country.
local places. No, not a country, no.
Oh,
It's
you mean in the...
States. In States,
the
or
United
even in
States?
this town where they have zero follow-up.
No.
And then they would call me a week after surgery. I do not know if this is normal. Those places don't want to see me. I still have a drain. I still have, literally.
What, a drain in their
Or
body?
I have
and there's
a,
no
a
follow-up?
wound, and then just told me to go to ER. I see it every day. Because I actually open my doors for people who come from out of town for complications, where most people will not see them.
Right. Somebody else's work, they don't want
Yeah, because they don't want to
so
take care of you if you went somewhere else. But I do. And I see it every day.
And can you speak to that a little more? Because I think about when you say cheaper is not always better and complications. What about the people who will go out of the country to get procedures that otherwise doctors in the U.S. won't do? Like I think about Kanye West's mom, who had
Right.
that procedure. Remember, she traveled somewhere else,
Yeah.
and the doctors here said no. Any thoughts on that?
Oh, they said no, that's why she
no
went out.
here, and she went
And-
And then she had a
to
problem. Okay.
get, yeah.
I mean, I know a lot of people go to like Dominican Republic and other countries, Colombia and stuff, because it's cheaper, right? We cannot compare cost in the United States to Mexico, Dominican Republic, because we have completely different set of rules, completely different cost of instruments, right? Completely different cost of our training and malpractice and insurances and all kind of things, right? So if you're going to a place that's giving you super cheap price, even locally, there are places like that, then you have to start questioning how are they cutting the cost? Which corners did they chop, right?
Right.
What are you getting? Are you getting super cheap implants? I've seen that. I've taken them out because people came to me with a problem and I'm like, go take out. I was like,
what is
these things don't even make them in the US. Like, how did it get into United States? You know?
And some of them are toxic actually, right? Literally
so
toxic,
you get like instruments that were not really optimized or FDA approved or certain, so you do not know what you're getting because you're asleep. I always joke with people. I was like, you go to some of those countries where there's no rules, you might wake up without kidney, you never know you had it. Done?
Right.
How do you know what was done to you? There's no regulations.
Yeah.
So yes, it's a little scary when people go out there. But yes, if doctors here say no multiple times, you might probably need to get a clue that they are worried about your health.
Right. Because there are signs that somebody may not do well.
Because maybe they're not cleared by cardiology.
That's right. That could be one of them. That's a big one.
That's a big one.
Right? Say,
I'm worried that you might not wake up.
Yeah.
And that's a big clue for you probably not to have that surgery at this moment. Maybe you can optimize your health and get better and then come back and try again. But it's definitely not a time to go outside the country to try to do that.
Yeah. Wow. So I think that all of this is critical for people to understand. Again, not just for these procedures, but any procedure. What are the things that, in your mind, if you could zoom all the way out, the things about bariatric surgery that people just don't know? If we haven't hit on them, tell us what those are. You want them to know this about bariatric surgery. And
that it will change their life for better. Remember, people who had great success with bariatric surgery do not go on internet and complain, because people will say, well, I had so-and-so who had problem. Yeah, that's very few people.
So really
there's thousands of people and millions of people who had the surgery and do great. They just moved on with their life very happily. They don't care to talk about it on Google.
Yeah.
It is one of the safest surgeries we can do.
Is that right?
I think side effects of elective gastric sleeve and risks and complications are probably less than like gallbladder surgery.
Wow.
Because gallbladder surgery often done as an acute procedure, and we always know
infection,
emergency procedures have higher risks of complications. People don't talk about it, but I always get really mad about it because if back when I took call in a hospital on the weekend, I could do 7 gallbladders in a day, right? Hey, somebody here with a gallbladder, let's take it out. I'll come to patient bedside. Hey, your gallbladder needs to come out. That's why you're hurting. Yes, doctor, please, doctor, take it out, doctor. Right. Nobody ever questioned how am I going to live without my gallbladder, how it's going to affect my life. What if my auntie going to tell me you took an easy way out, right? They don't do that. But I would come to him like, look, you're 350 pounds. I think you're going to die of heart attack in 5 years. Let's do gastric sleeve right now. Oh, no.
Right.
Right? Why is that? I think it's part of obesity bias.
The obesity bias.
Right? Because we do so many surgeries.
We call it a disease, but it sits over here in our mind.
But nobody believes, like a lot of people still like, oh, go home, eat less, exercise more. We know it doesn't work in 99% of the people.
Yeah.
Right? But we keep telling, because I can tell gallbladder patients the same thing. Go home, take a couple antibiotics, eat less fat, eliminate all the fat out of your diet, bear with it for a few days. It's going to get better. You don't have to do it again if you don't eat fat.
Right. As long as
so why is it okay to take out your gallbladder, which may take longer than gastric sleeve in some people?
Wow.
Because gastric sleeve is under an hour. It's like 45-minute surgery in good hands.
Right.
It's cheaper than tummy tuck.
Yeah.
It's cheaper than BBL. In my surgery center, it's like $9,400 for gastric sleeve.
Wow.
All included, anesthesia, everything.
Yeah. No, that's big. And so I push people towards sleeve, and I send them to our referrers. Now I have another referrer because of what I see, which is
heart disease.
Blood pressure goes down to the point where I'm running to pull the medicine off the people who will stick with the program. Right. Just go get a sleeve and then sign R, because there is, the excellence doesn't stop when you leave the surgical center. It has to continue. But I see blood pressure medicine go away, the cholesterol, A1C, diabetes, right? And the people who keep up with it. So I'm thrilled about the longitudinal, the long-term
Absolutely.
benefits of bariatric surgery. I've never thought about it in the obesity bias playing a role there, because if somebody has a quadruple bypass, we're not going to say the same things that we would say to somebody having obesity surgery.
What leads to quadruple bypass? Why would somebody get blockages in the
Right,
artery?
that's right. Yeah, many of them, not all.
Not
many
all.
of them, it's a lifestyle, it's a choice, right? You've eaten the wrong things, you haven't exercised. Not all.
Maybe smoked.
Maybe smoked a lot, right? So those people, sure. But you're right, we don't have the same kind of, hey, I can't believe it, stop smoking,
Yeah,
Well,
stop
I do
smoking.
that, but not everybody.
Do a little walking.
Yeah.
Your blood vessels will recannulate and open up
Right, yes.
eventually.
Yeah, we don't
You
tell
know,
them
why are
that.
you taking
That's
easy way out doing quadruple bypass?
right. Right, the easy way out.
They're taking easy way out, guys.
Yeah, we never say to a bypass patient, you're taking the easy way out. We should not be saying it to patients who will benefit long-term from bariatric surgery.
Correct.
Man, that's so good. I hope y'all are drinking back what she is pouring out, because this is the stuff that we're trying to give you on the Health Mastery Cafe. I want you all to help me thank Dr. Angelina Postoev for being here and laying it down.
Thank you.
Y'all, I want everybody to learn how to get in touch with you, both for surgical consultations, and then you've got some really interesting things going on. Tell us about those things.
Well, the easiest way to find me and to remember Dr. Angelina MD on TikTok, that's my account, Dr. Angelina MD. And the most exciting thing that's happening right now, I have an event on June 1st. I'm actually going to do more of those events, probably a couple times a year, specifically for people who are going through the journey, health journey, losing weight through whichever method, and all the way through plastic surgery. It's called Journey on the Jab.
Journey on the Jab.
It happens here in Atlanta, in Buckhead, June 1st. I'm renting out a beautiful place. We're gonna have food and drinks and DJ, and we're gonna have a panel where we're gonna do a Q&A, do some free gifts, and people coming from all over the world, Atlanta, different states, everywhere, to meet each other, to learn from each other, to see how everybody's doing. And we're gonna continue to do that, to teach people about obesity as a disease and the management, and how it's okay to do that.
Yeah. Well, if it's anything like we've had today, it's going to be amazing. I'm coming.
I hope so.
June 1st, Journey on the Jab. Dr. Angelina, thanks so much for being here. And as always, remember this: there's nothing more important than your health. Now go master it.